Hello everyone, I'm Tejaswani Dash and today we will discuss about the case study that I have done on patient satisfaction quality measure for University of California Medical Center, San Francisco. This presentation was prepared as a part of HAP 725 course on Statistical Process Improvement taught by Dr. Farrokh Alemi at George Mason University, Department of Health Administration and Policy. The hospital I have selected for the case study is University of California Medical Center, San Francisco, which is also known as UCSF Medical Center, and it is located in San Francisco, California, with facility ID 50454. There are different ratings on different rating websites on UCSF. For example, Google has a rating of 3.7 and Yelp has a rating of 3.5. Whereas CMS, that is Center for Medicare and Medicaid Services, gave a 5 out of 5 overall rating to UCSF and a 4.5 out of 5 patient satisfactory rating to UCSF. Source of data. The information I have gathered is on annual basis. However, it is updated every 3 months and I am looking at statistics from 2014 through 2021. The data comes from the Center for Medicare and Medicaid Services, which is a free website that allows anyone to learn about new statistics for hospitals across the United States. I specifically studied at a source data called Hospital Customer Assessment of Healthcare Providers and System Patients Survey, which gives critical information about patient satisfaction. Measures. These are the measurements I have decided to use. First one is patients who reported that they were given information about what to do during their recovery at home. Second, patients who agree they understood their care when they left the hospital. Third, patient who reported they would definitely recommend the hospital. Fourth, patient who reported that the staff always explained about medication before giving it to them. Fifth, patient who reported they did receive written information about possible symptoms to look out for after discharge. Most of us might be thinking, why only these measures? So, while browsing the UCSF website, the phrase, "We measure our performance against our own stringent standards and compare the outcome of our care with top medical centers countrywide in an endeavor to continuously improve the care we deliver." This is the phrase that caught my attention, and I thought to myself that these measurements are critical in achieving UCSF goal, as they are linked to the percentage of readmissions, and determining these will really reveal whether patients are returning to the hospital or being readmitted due to malpractice, as well as whether the information provided is of sufficient quality for them. We are also concerned about these measures because if readmission rates are low, patient will have more faith in the hospital's ability to provide high quality care. Here, I compare UCSF Medical Center with 3 other peer competitors. First, Kaiser Foundation Hospital, that is located in South San Francisco, California. Second, Mayo Clinic Hospital, that is located in Rochester, Minnesota. Third, Brookdale Hospital Medical Center, which is located in New York. The simplest strategy to choose a competitor is to look at the common equivalent services provided by the hospitals. For example, here UCSF and its competitors offer similar services that are mostly focused on cancer and organ transplantation. Why these hospitals? I chose these hospitals because I was curious in the various type of care providers in various parts of the United States and the level of quality treatment that patients are receiving. Before I began my work on my dataset, I kept in mind UCSF's vision and without compromising or sacrificing its quality care credentials, I attempted to analyze my quality measurements across the country. Taking in account UCSF's competition list as reported by Yelp and Google and Owler. While conducting this case study, I encountered difficulties in determining the appropriate patient satisfaction measurement for a broad comparison of hospitals. Furthermore, data from a certain year is lacking. These are the major limitations I discovered. In all my 5 control charts, the red line represents the lower control limit and upper control limit of all the competitor hospitals compared to UCSF Medical Center. This is my first control chart that is based on patients who reported that they were given information about what to do during their recovery at home. In comparison to other hospitals, most patients agree that information is provided to them prior to discharge. However, in 2020, there is a decline causing patient unhappiness. This is my second control chart, which is based on patients who agree that they comprehended their treatment after they were discharged from the hospital. UCSF data revealed a gradual drop over time when compared to other institutions, that is competitors, as patients struggle to understand their care after discharge, resulting in patient dissatisfaction. This is my third control chart that is based on patients who reported they would definitely recommend the hospital. UCSF Medical Center stays between the lower and upper control limit in contrast to other hospitals, showing that it is under control. There was a steady decline trend between 2014 to 2017. However, we can witness a steady rise and development after that, suggesting patient satisfaction with the service. This is my fourth control chart based on patient who reported that staff always explained about medication before giving it to them. Here, in contrast to other hospitals, basically competitors, UCSF Medical Center keeps between the lower and upper control limit, indicating that it is under control. Between 2014 and 2019, we can see there was a consistent downward trend. We can also witness a quick change in drug knowledge comprehension by 2020, but we can also notice a fall in 2021. These findings show that drug comprehension varies, causing patient dissatisfaction. However, we may see a change in medicine knowledge or medication knowledge in the future. This is my fifth control chart. Unfortunately, the data I worked with was from the last 3 years and previous data was not available. This control chart is based on patients who reported that they did receive written information about possible symptoms to look out for after discharge. Here, in contrast to competitor hospital, UCSF Medical Center keeps between the lower and upper control limit, indicating that it is under control. In comparison to 2020 and 2019 data, there is a continuous fall in 2021. We can see it through the graph. That means that during the year 2021, there was no consistent patient satisfaction. Patient was dissatisfied and unhappy. Summary and suggestions. While working on all my parameters, I analyzed that in all the measures there is a steady decline in graph while moving towards 2020 to 2021, except patients who reported they would definitely recommend the hospital. As per other statistic, this is the time frame of COVID-19 pandemic. As per my analysis, time frame fact and substantial evidence, I think pandemic might have disrupted the hospital's workflow, caused significant traffic congestion, and affected the patient satisfaction rate in 2021 for University of California Medical Center, San Francisco. Suggestions. I believe there is a room for improvement, such as ensuring that patient understand discharge instruction properly, by solidifying patient care quality, and also encouraging patient to ask queries, and also to create a safe environment for communication. Hereby, I rest my voice. Thank you so much for listening and understanding my work patiently. Thank you.